I'm NewBeauty's Director of Aesthetic Content, Tatiana Bido, and today I'm joined by West Orange, New Jersey, and New York plastic surgeon, Dr. Mokhtar Asaadi, an esteemed plastic surgeon that I've been working with for so long. He's known as the eye guy for a very great reason. He treats a very specific concern. They're called Festoons and Malar bags. And there's a lot of mystery and misinformation surrounding this concern. So I'm here to ask the man himself, Dr. Asaadi, to give us some insight on this condition and these procedures. How are you, Dr. Asaadi?
Good morning. Thank you, Tatiana.
Thank you for being here with us today at NewBeauty. And I'm so excited to talk about this with you because we've been talking about Festoons and Malar bags for so many years with you specifically. How long have you been treating Festoons and Malar bags?
35 years.
35 years. And you are the expert. People come to you to learn specific techniques. We were just at the aesthetic show in Boston where you gave a wonderful talk. People were coming up to you and saying, you know, I've been following you for so long. Thank you for doing these educational talks for us and sharing your expertise. So you've been known for treating this difficult concern. What drew you to this area of expertise?
Well, I'm doing the plastic surgery for 42 years. And about 35 years ago, a patient came to me who had a festoon, and she wants to have her eyes done and face done, and asked me, what is this puffiness I have below my lower eyelid? I didn't know anything about it, so we tried to correct it. So we did a so-called traditional blepharoplasty, facelift, and she comes back after surgery and she tells me, why do I have this puffiness? So what I did next was that I said, well, let me, on the local, just do a little bit liposuction in the office. That didn't work. So then I became obsessed to find out what is causing this puffiness here, how should you treat this, and then we go one patient to another, and so you go to the meeting, and when they ask about the festoon, nobody raises their hand. They say that we cannot correct it, or there's some people say you have to go and cut them directly. So working on this for so many years, probably I know something about it today.
I think you do. And how would you describe for someone who doesn't really understand, what's the difference between normal under eye concerns and a festoon? How can someone tell if that's what they're dealing with?
Well, lower eye stops in this crease that we have here, and then festoon starts below that one. Festoon terminology started in 1978 by Dr. David Furness from California. He used that terminology and he wrote the original article about it. The most important thing is that the terminology is not perfectly right, and the clinical presentation is not just one way of it. He was talking about wrinkling and puffiness, but we see a lot of young people who come to you and they don't have a puffiness, they have a crease, they have a line.
Right here?
Yeah, so I wrote in 2018 something about congenital festoon in the people who have this in their entire life, and they're young, and usually somebody, member of the family has it. So you cannot just say the festoons are having one sort of the presentation. You have to know the anatomy of this area, pathophysiology of it, and then go and do the right treatment for them. It's not just the one treatment you do this.
So it's not just a wrinkling of the skin or a sagging here. It's also the fat. It's also the muscle too, right?
Well, we have from outside, we have a skin. We have muscle, and then we go to the deep part of the lower eyelid and the face, which is fat there. And there is a confusion about the fat of this area. The people who are authority about describing this, which is Dr. Mendelssohn from Australia, he uses different terminology than what I use because there is something called SUF, suborbicularis oculi fat, which is under the muscle described in 95 by Aichi and Ramirez. He calls that SUF the top, the roof of the festoon. I don't see that one when I operate on the people. So in 2019, I wrote something about it, which is I call anterior septal fat or abnormal fat. that you do not see in the people who do not have a festoon. And this particular fat has to be removed in order for them not to get puffiness after surgery. So it's so much detail in this area. And many people try to do the laser treatment, do the non-surgical treatment, inject them with something that doesn't work. You have to go to the basic anatomy and correct these people. So when I do surgery, I look at these people from outside, inside, and I want to see what is causing this area of the puffiness and the crease of the lower eyelid, which we call it prezygomatic area.
It's fascinating, and you've done so many cases, and we were just going over all of the cases that you've done over the years, or some of the cases, I should say. And some of them include a Malar bag. What is a Malar bag, and how is that different from a festoon?
So that's all the category of the puffiness here should be called Malar bags.
Okay.
We classify them to the people who have them from early age. We call them Malar mound or congenital festoon.
Malar mound.
M-O-U-N-D. The people who have an allergy and have a puffiness, we call them malar edema. They have hypothyroid problem. Because of the aging, we call it malar festoons. And then I also added the iatrogenic, that you go and get treatment done by fillers or Botox and makes them worse.
Got it.
So malar bags is
the
an umbrella, and then you have all this sub-classification of them. So you have to know which category the patient is in order to do the right treatment.
And for festoons, it can present in a younger patient, like you said, if you're genetically inclined to develop festoons over time.
Yes, and those are the most difficult way to treat them. The easiest way is the one that has really aging and the laxity of the muscle. Those are the one that you can 100% correct them.
This might be a silly question, but would you know, because looking at your parents and your grandparents, that they had it too? Is that a simple way of sort of knowing that it's more genetic?
Yeah, I mean, these people that they come to you, they say, well, my brother has it, my father had it, or my mom has it, and they bring the picture. Or if the mom comes, you look at the daughter, you see that the daughter also has it.
Right.
Yeah, so there is a genetic predisposition for this.
Is there a certain time that it's better to do the surgery? Should you do it younger, or is it something that you should, when it gets worse, address?
The point is that in the young people, you have a little bit crease here, and you ask them, why does it bother you? And then they tell you, this bothers me from a scale of 1 to 10, 11.
Yeah.
And I say, why does it bother you? They say, because it makes me sad. I have to wear glasses all the time. That's why I want to correct them. So not everybody has a puffiness there. So you have to know which patient you are dealing with. And some people who want to go and cut this thing directly by direct excision, you don't want to do them in the young people who have a little bit line there.
Yeah.
So that's why I make this procedure very challenging and very difficult.
So for anyone who's going and getting a recommendation to just remove it surgically by cutting it out, that's not working.
It does work in certain group of the people. For example, if the person is very old, if they have a very light skin, if they have a medical condition. So you have to use a medical judgment to see what's the best thing to do it. But direct excision, I have done probably 3 of them out of the few hundred that we have done the traditional way that I do them.
Right. And then you also do a lot of revisions. So can you talk a little bit about that? What are people, or I should say, what are other surgeons getting wrong when they're addressing festoons that you have to correct behind them?
Okay, so typical case is this. The patient has this puffiness here. They go to the physician, local, whatever, or they go to the statistician.
Right.
As a general, they say, well, we are going to inject you with the fillers to correct this. Filler is done. They get worse, or they are not helped. They dissolve the filler. They go probably another time down. And 80% of my patients that I see had a treatment done before, either non-surgical or surgical. The point that we are trying to clarify with this kind of the interview is that you have to let the patient, the consumer know that what is the terminology. First of all, they have a hard way to find out what is this called here. Then they find it, then they Google it, then they find out about it.
Right.
And then what they do, they have a hard time to find out which person does. And one person in Florida does a laser treatment, one person in New York does a direct excision, then I do my own way of treating them. So the patients are confused, they are very upset, they spend a lot of money and a lot of time
Yeah.
They take a lot of time from their business and work, and then they become very unhappy with the results.
Yeah. So they should just come to you first, right?
And not to me, to the person who knows how to do them, but
right.
unfortunately, there are not that many people who want to do this surgery. It's very hard, very time consuming, and you have to spend a lot of time before and after surgery with them.
And it's very meticulous.
Very meticulous. We used to do the eyelid surgery for 2 hours when I started. Now when I do this area, and also I do this part of the face, which is called mid-face, which is part of the festoon.
Yeah.
That takes me sometimes 3 to 4 hours.
And for a lot of patients that come back and you say this is, this is an emotional problem too, right? You're taking care of someone who has had a negative result, or they didn't get what they want maybe 2 or 3 different times. So this is life-changing.
Of course.
Yeah.
Because beside the patient, it's a lot of the strain and pressure on the family, on the husband, the boyfriend, because patient always is upset, is crying, they're not functioning.
Yeah.
I can tell you stories after stories that some people, they don't want to go to the work.
Yeah.
And it's a life-changing for them.
Yeah. And you talked about trying fillers, lasers. Some people try lymphatic drainage. Are you, like you said, are you compounding the problem by trying all of these different things?
In summary,
In some people.
no, there is no way you can correct this with non-surgical treatment. This is the conclusion. Everything you do is going to cause more scarring, is going to make your surgery more difficult, because you are creating more scar and more problem with the lymphatics.
Underneath the tissue you're creating scar tissue
Scar
by whatever
tissue,
you're doing.
And the fat has a lymphatic around it, and that lymphatic becomes worse by multiple treatment with the injection and dissolving them and using laser and everything else. So that's why you have to see them when they're not touched, to do the right procedure for them, and you get between 90-95% improvement.
And how long, you said it was a little bit of a longer surgery. How long should a patient expect to recover? How long is recovering?
So this is the question that we always exchange with the plastic surgeon. I ask them, why don't you do the correction of the festoon? They say, well, the recovery is long, and there is a potential that your lower eyelid might come down. It's called lid retraction or ectropion. And there is something that you get like a water in your white part of the eye. It's called chemosis. They are afraid of that. If you do the right surgery and also know your patient, that I call it protoplasm. Protoplasm means that if you have a good tissues, you don't get the puffiness, you don't get chemosis, you don't have a prolonged recovery. So I have patients that I have a video of them that they had a surgery done. They have a little bit of the regular post-operative swelling about a week or so.
Yeah.
So don't let those items that is bothering the average person who doesn't know about this bother the patient. But there are certain patients, when I see them, the tissues are not good. I call it not a good protoplasm. They get more puffiness, but they're all transient. They're not permanent. And then you have to give them a lot of treatment before and after to correct this.
And how long should you expect to be, out of the public eye? Like 2 weeks?
No, you can go back to work if you want after a few days. You don't have to be out of.
Oh, wonderful.
Yeah, it doesn't take too long.
And for somebody who is considering maybe a lower facelift or a neck lift, can you do it in conjunction with those procedures as well?
Yes.
Yeah.
So this area of the face is mid-face.
Yeah.
So when I correct this one, this is pulled completely upward, is a vertical direction.
So you're getting a little lift a little bit.
No, you go like this.
You go up.
This direction is the face. So when you do combine them with the face and neck, you do the lower face and the neck, because this part is already corrected.
So you get a rejuvenation.
Yes.
And then what misconceptions do patients have when they come into your office after they've searched online? What are you educating them about that they're getting the wrong information online?
Well, the point is that you have to spend a lot of time to examine them, take a good history of them to know what they went through, and then give them all the options and tell them the realistic expectation. So the older person with the aging is the easiest thing for me. Young person with the lines are difficult one, and they have to know that they might have some residual line and they might need extra treatment. And sometimes also I wrote something about Kybella. Kybella is approved for fat in the submental area. I use them as an off-label for the people who have a puffiness after surgery.
So a little bit of Kybella off-label. And
After a few months, if they have puffiness, I inject them there to get rid of the fat. Because the fat can be under the muscle in this area or above the muscle under the skin.
So that's a way to get to it without having to have any
More
additional
surgery done.
surgery.
Yes.
Very interesting. And what is one patient result that really made an impact on you?
I have many patient results that impacted on me. But as I talked to you, there was one patient that had this problem from early life. From 20 years ago, she had 7 surgery on the right side, 3 surgery on the left side.
Wow.
They come to you and they say, why should I trust you? I went through all of this. So the people are life-changing. And the husband was telling me that my wife is crying, doesn't go out, doesn't socialize. And they are high-risk people because she also had a hypothyroid problem. She had also no cheekbone. We call it negative vector. But if you know the anatomy and you know the safe surgery, you can help them tremendously. You cannot do the same surgery for every person.
Right.
You have to know, and sometimes I do not make the full incision in the people that had the surgery before. I call it short incision, and there is no way I can get any retraction of the lower eyelid.
And you mentioned too with that particular patient that she had her first surgery in 2007. So we're almost 20 years out. So
Yes.
that's a long journey just to get it right.
So can you imagine you go 20 years with multiple surgery
Right.
every year and still not have a right result?
And surgery on your face. So it's not something that you can
cannot
just
hide
hide it or wear, a bigger dress and go to a birthday
So
party.
this is what I should tell you. There are
Yeah.
2 surgery very difficult in plastic surgery. One is no surgery, rhinoplasty.
Yes.
One eyelid surgery. The difference is that if you have problem with your nose, you cannot breathe, at least you can not show it.
Right.
With the eyelid surgery, if you don't make it right, you are going to be miserable because you are going to have irritation of the eyes, tearing of the eyes,
Yeah.
and also you cannot hide it.
Right. They always say that line that the eyes are the windows to the soul because we always look at each other in the eyes when we're talking to make a connection. So you don't ever want something that makes you feel embarrassed or ashamed. So I can imagine that
Yeah.
the work that you do is very fulfilling when you do see those results.
Yes.
Yeah.
What I want to tell you something. So you mentioned eye guy, but I want to just clarify. I do other plastic surgery too.
I was going to say that
Because-
before we finished our conversation
Yeah,
that
yeah,
you're not
please.
just the eye guy.
Yeah, so don't just put it that this guy is an eye
Yes,
surgeon.
We're going to put a big disclaimer.
Yes.
Also, the body guy. Also, the facelift guy.
So
So my last question to you is about the future because you are a pioneer in this treatment and this procedure and this surgery. What do you see happening in this space? Do you think more people will address this at a younger age when they find out that they can have a surgery like this?
well, this is still not completely out of the problem we have because that line that we have there that I think is because of the tendon coming there right
Yes.
here in this area, which is like a crease in this
Which
area.
you mentioned is the ligament.
It's called zygomatico-cutaneous ligament.
Okay.
This ligament comes from the bone, comes all the way to the skin. I release them when I go under the muscle. Then that coming right to the skin area, this patient that I had recently had a little bit line there, and I try to break them down with the cannula after surgery, but they are extremely difficult. So do not give 100% okay for the younger people with the line to go away. You have to be realistic with them and tell them there is a 5%, 10% that you might have to do other things for them.
Are you seeing that more now too because people are losing weight with GLP-1s? Is it becoming more prominent?
No.
Or that's just... No.
Weight doesn't affect them, but the problem with that medication is that it changes your tissues. Every time you operate on them, on their face or the body, the healing is not the same.
Right.
They get more puffiness, they have a prolonged swelling. The tissues, when you go there, they're not like normal, they're softer. There is something about them.
Yeah, that's
They're
what I'm
different.
hearing a lot from plastic surgeons like yourself, that now that we've have so many people on GLP-1s, that it is a little different performing surgery, right?
Yeah,
Yeah.
you can do them safely, but the tissues are different.
Yeah. Well, so many interesting things to talk about, Dr. Asaadi. I know you'll be back so we can talk about more body work and facelift topics, but for now, you are the eye guy. So I'm super grateful and thankful that you've been here today to talk to New Beauty. Thank you so much.
Thank you for your time.
Thank you.
Good to
Thank
see
you
you,
for your
Tatiana.
time. Thank you. Thank you, everyone.